All right. Good afternoon, everyone. My name is Marvin Judd. I'm from the EUTF. Thank you for joining us today at this 2021 Open Enrollment Informational Session for active employees. I'm going to go ahead and share my screen with you folks. Okay. So again, thank you for joining us. Myself and my partner Cully will be answering questions at the end of this presentation. So just feel free to write it in the comment section. We'll try to answer it as best as possible at the end. But hopefully all your questions will be answered as we go through this presentation. Okay, it's really informative. We're glad that we can put it on for you folks. So I want to be respectful of everyone's time. So I'm going to go ahead and get started here. Okay, so first off, we'll go through the agenda for today. So we'll talk about open enrollment, some online resources, plan changes, that's a big one, of course. And then health plan selection. This is where we kind of talk about what things to kind of consider when picking the right plan for you and your family. Enrollment forms. So the different type of forms we'll go over, the EC1 form and what you need to fill out to get this done. And then we'll follow it up with money saving tips and wellness programs. Okay, so of course, the most important thing is the election period. So the election period is going to be from April 1st through April 30th. Okay, employees who wish to enroll or make changes must complete an EC1 or EC1H for those of you that are enrolled into that grandfathered in HSTA VB benefits. Okay, so if you're a new teacher, you're probably not enrolled into this benefit. So you would just use that regular EC1 form. But if you're one of those older teachers, you might be grandfathered into this HSTA benefits. So you would use that EC1H form. Okay, if you're not sure which one you're in, you can always call our office and we can double check for you. So the enrollment forms and any required proof documents to your departmental human resource office, county personnel office, DOE EBU. That's where you folks want to send it. Okay, it's actually in the top right-hand corner of the EC1 and EC1H form. Okay, where to send it. So you need to send it to DOE EBU. Don't give it to your secretary or your SASA or anything like that. Okay, you want to mail it straight to its appeal box. It's at the top right hand of the form. Okay, for employees who do not want to make changes, no action is needed. Okay, so if you're happy with your plans, right, do nothing. It just kind of rolls over until the next plan year. But if you are thinking about making changes to your plans or adding or removing dependents, you need to turn in an EC1 form by the deadline of April 30th. Okay, there is a processing period. So enrollment forms received on or before the deadline will be processed during the months of May and June. Once that enrollment is processed, a confirmation notice will be mailed to the employee. If they do not receive a confirmation notice by the end of June, please contact EUTF. If employee is not making changes during the election period, they will not receive a confirmation notice. Okay, so of course you only get this confirmation notice if you fill out any forms with our office, right? If you're happy with your plans, it just rolls over. You don't need that confirmation notice. Usually you'll get that confirmation notice by the end of May, maybe early June. So if you don't get one by mid-June or late June, make sure to call our office. Okay, that means something happened, forms are missing, we're missing supporting documents or something. Okay, so just keep that in mind. And then the new plan year, the new benefits, the new premiums, all that good stuff is going to start July 1st. Okay, so even though we have open enrollment in the month of April, it doesn't really go into effect until July 1st. Okay, so the new premiums from state employees will be deducted from your paychecks on July 20th. Okay, for county employees, it's July 15th. So make sure that you remember that change. You don't want to see new premiums and be like, hey, what's going on? So the 20th for state employees and the 15th of July for county. Okay, so let's talk a little bit about our online resources. So, this COVID-19 pandemic really hit everyone. So we're really trying to help you folks out by putting a lot of things online. So if you go to our website at eutf.hawaii.gov, you can learn about your health service options, coverage for COVID-19 testing, treatment, and vaccines, how to seek health services, and how to prevent the spread of COVID-19, right? We're all experts at that already, or we should be by now. But yeah, we will put as much information as we can about COVID-19, anything new from the CDC. We usually will try to put that up there just to keep you guys as up to date as possible. Okay, this is the virtual fair. We are in open enrollment right now. We actually have a presentation a little bit later on during the day. So this is what the virtual floor plan looks like. Okay, so it's a snapshot right there. You can attend a live webinar for EUTF members. So we put on a live webinar, and then each carrier actually has a pre-recorded voiceover about their benefits. Okay, so if you guys ever need extra extra help with your benefits, like let's say you need more information about HMSA or more information about Kaiser Permanente. You could just click on their icon, you can watch their video, download their resources and pamphlets. We make it really convenient for you folks. It's called the Open Enrollment Virtual Fair. You just have to click on the Learning Center and then click on the virtual fair, and then it'll take you to this page right here. So of course you can do that whenever you guys want, all through the month of April. And then we also have an active employees tab. So on the blue ribbon, you can click on active employees, and then a drop down menu will appear, and then you can download the open enrollment checklist, download the EC1, EC1H forms, the reference guide. We have a premium contribution table if you want to check the premiums. And then we also have a premium calculator. Okay, it's a really neat tool where it lets you compare up to two other plans to your current plan. Okay, so you can see if you're going to save money if you switch plans, or if you're going to spend more money if you switch plans. Okay, it's called the premium calculator. And then we also have a plan finder. Okay, we were getting a lot of calls from members that forgot which plans they were enrolled into. Okay, I don't know how that happens, but it happens a lot. Okay, so we have a plan finder where you can just type in um, what gets deducted from your paycheck, and then it automatically finds which plan you're enrolled into. Okay, so those resources are all available for you folks. And then if you guys are like me and you guys want to retire already, you guys can watch this pre-retirement informational session that we have. Usually we have one every month. Of course, we don't have one this month because we want to focus on open enrollment, but every other month we put on this presentation. It's basically to prepare you for retirement, what things you need to know. We talk about Medicare, what kind of plan options you have when you retire, all that good stuff. Okay, so it's a lot of information. So we always recommend that folks, start watching this as soon as possible, and then watch as much of these as you can before you actually retire. Okay, so you don't have to sign up or anything. You just go onto our website, eutf.hawaii.gov, click on the Learning Center, and then click on Thinking of Retirement. And then you can watch this when we have them. Okay, and then we wanted to talk about this new benefits administration system that we're really excited about. We've been working on this for the past year already. So it's for employers to have portal access, and members and retirees to have a self-service capability. Okay, and then I'll talk about the implementation project timeline. Okay, so for employers, they'll have access to your members' demographic, employment, and current benefit coverage and costs, as well as history, members' life event history, coverage changes, view employer invoices and remit payment, secure messaging with EUTF, access to standard reports with export to Excel, transmit HR files securely through the portal. Okay, so we're trying to make this self-service. We're trying to make it as easy as possible for you folks and for personnel to get a hold of us and to give us your information as securely as possible, right? Right now, we do it kind of through snail mail, or sometimes you can fax it. But this way, if we do it securely through this new BAS system, it'll make everybody's life a lot easier. And then upload documents to EUTF. Okay, so that's the employer side. For the employees, for our members, we're going to implement a snapshot of your current coverages and premiums, so you can check that out whenever you can. Secure messaging with EUTF if you have any questions. Online open enrollment and life event changes. That way you can do open enrollment all through your computer or desktop, and then upload supporting documents for faster processing. So instead of mailing it to your personnel and then they gotta, forward it to us, we'll make it more streamlined. Okay, so we're in the works with this. It's been over a year. We've been working with the new carrier to implement all these changes. So we're really excited about this, and we will keep you posted on when we go live. Okay, so we're halfway there. We started this back in June 1st of 2020, and then our go live target date is going to be February 1st of 2022. Okay, so we're halfway there. So far, everything's running smoothly. So hopefully we can get that out on schedule. Okay, plan changes. So let's talk about the plan changes for July 1st of 2021. So first up, let's talk about HMSA's plan changes. So they excluded the bariatric surgery for out-of-network benefit for the EUTF 7525 plan. They subjected out-of-network mammogram screening to the deductible for the EUTF PPO active employee plans. And then they added a medical nutrition therapy benefit at a standard in-network and out-of-network coverage for all the EUTF plans. And then they also increased the members' cost share from $20 per session to the plan standard in-network coinsurance, and narrowed the eligibility criteria for Dr. Ornish program for reversing heart disease under the EUTF and HSTA VB plans. Okay, so for Kaiser Permanente, they increased the members' co-payment from $10 to $20 for basic laboratory tests and general imaging under the EUTF Kaiser Permanente standard plan. The facility-based diabetes prevention program ended 12/31 of 2020, and then they're going to apply a $0 copayment for the following preventative screenings and lab tests for members diagnosed with specific chronic conditions under the EUTF and HSTA plans. Okay, so A1C testing and retinopathy screening for individuals diagnosed with diabetes, LDL testing for individuals diagnosed with heart disease, and INR testing for individuals diagnosed with liver disease and or bleeding disorders. Okay, and then last up, CVS has a few changes as well. They're going to increase the maximum out of pocket for the 7525 plan to 3,150 per person and 6,300 per family. They excluded Glumenza and Fortament and their respective generic formulas from all EUTF active employee drug plans. They added coverage for exumestine and unastrozole um, for women 35 years or older when verified that the medication is used for breast cancer prevention. Members must use the exemption process to validate preventative use. And then they also updated the coordination of benefits for secondary cardholders. Co-payments may be subject to change. Okay, so there's a few changes this year. Really not as much as there usually is. Um, and then last up, employers and unions are in negotiations to establish an employer-employee premium contribution. Okay, so every few years, the unions negotiate with the employers on what your medical premium splits are going to be. Okay, so we already have what the premiums are going to be. We just don't know how much the employer is going to pay and how much the employee has to pay. Okay, that usually gets finalized um, sometime this month. Sometimes it's next month, but it's always usually before that July 1st deadline. Okay, so don't worry too much. Right now, the employer premium contribution amounts for July 1st of 2020 to June 30th of 2021 will be used until an agreement can be reached. Okay, so the premiums that you see right now are actually the old premium splits that we're going to use. Usually it's like a 60-40 split. Um, we're going to use those until the new ones are negotiated and reached. And then as soon as that happens, we'll post it on our website so you guys can see and have a more accurate determination of what's it going to look like. Okay, so for right now, it's just an idea of kind of what it might look like. But again, it's not set in stone and we have to wait for those negotiations to finalize. So if you have any questions about the negotiations and how they're doing, you guys don't have to call us, right? You guys got to call the unions and double check with them. Active employees should pay special attention to the premium rates which will be posted um, in March. But again, we have to wait for them. Okay, moving on, health plan selection. So we do this every year, so things to consider. So of course you want to know what the premiums are, how much you're going to pay, can you afford a different plan, or maybe I want to save some money, I'm going to try a lower plan. Okay, so you always want to know what the premiums are every plan year. Deductibles. Deductibles are just like car insurance deductibles, right? You have to pay a certain amount upfront and then your benefit kind of begins. Okay. Really, the only plan that has a deductible is the 75/25 plan. Okay, it's this $300 deductible. Um, but if you're enrolled into that plan, you know that that $300 deductible doesn't apply to all services. Okay, so you want to be aware of that too. Calendar year versus plan year. Some benefits renew January 1st, which is a calendar year. Some benefits renew July 1st, which is a plan year. Okay, so a lot of the dental and vision benefits renew July 1st. A lot of the medical benefits will renew January 1st. In-network versus out-of-network. So you get the most bang for your buck, right? If you go in-network, but some of our plans you can even go out of network. Okay, it has that flexibility. So you want to be aware of which plans you can go in and out of network. Uh, which plans has a wide variety of in-network providers so that it's more convenient for you. So and then co-insurance versus co-payment. So co-insurance is based on a percentage of an eligible charge. Co-payment is a fixed dollar amount. So a lot of the HMO plans has a fixed $15 or a fixed $20 whenever you go get a service. Co-insurance is based off a percentage. So if you have like the 80/20 plan, right? You pay 20% of whatever the eligible charge is. And then last up, maximum out of pocket. So maximum out of pocket is there for your financial protection just in case of a catastrophic injury or illness. What it does is it puts a cap on how much you have to spend out of pocket. Once you hit that cap, your benefit pretty much turns into 100% benefit, meaning the insurance company will pay for most of your bill, if not all of it. Okay, so you always want to be aware of your plan's maximum out of pocket. Again, it gives you financial protection, all covered co-insurance, co-payments, and deductibles gets applied towards it. The insurance company keeps track of it, so you can always call them to double check where you're at. Once that maximum out of pocket is reached, your plan becomes 100% coverage. Okay, members are still responsible for things like taxes, though. Okay, so keep that in mind. And then it resets every calendar year. So every January 1st, it's going to reset. Okay, so be aware of that also. And then you have to contribute towards it again. And then if you hit it, everything's free for the remainder of that year. And then it'll reset again. Okay, so this is just an example of each plan's maximum out of pocket. So for the 90/10 plan, 2,000 for single, 4,000 for family, 80/20, 2,500 for single, 5,000 for family, and so on and so on. So every plan has a different maximum out of pocket. Okay, so to put all of that into an example to help you pick the right plan, we have this example for you folks. Okay, so Rick is considering enrolling into either the 90/10, 80/20, or 75/25 self-only plans. So the first thing Rick wants to look at are his annual employee premium contributions. Okay, so for a whole year, how much is he going to pay in just the premiums? For the 90/10 plan, it's $5,930. For the 80/20 plan, it's $3,530. And then for the 75/25 plan, it's just over $1,000. Okay, so let's give him a scenario. Let's say Rick anticipates 4 doctor visits during the calendar year. His doctors charge $100 per visit before insurance pays, so a total of $400. Under the 90/10 plan, it's a co-insurance, so we have to take 10% out of that 400, which is $40. There's no deductible under this plan, and the maximum out of pocket is 2,000, so it's not met there. So it's just a co-insurance plus the premiums for that year, $5,970. Let's do the same thing for the 80/20 plan. 20% is $80. There's no deductible, and the maximum out of pocket is 2,500, which isn't met there. So it's just a co-insurance of $80 plus the premiums for that year, $3,610. Okay, last up, let's do the 75/25 plan. So 25% or $100. Remember, this plan has a deductible, but if you're already enrolled into the plan, you know that it doesn't apply to doctor visits. Okay, so we can cross that out. It's just a co-insurance plus the premiums for that year, $1,100. Okay, so the plan that saves the most money in this scenario is the 75/25 plan. As you can see, it saves thousands of dollars, right, compared to the other plans. So it's a great plan if you're single, you hardly get hurt or sick, or maybe you just hardly go to the doctors. Maybe you're afraid of the doctors. You don't want to go there. This is a great plan for you. You could save thousands of dollars in just premiums, right? So this is kind of best case scenario. What happens in the worst case scenario? What happens if you have a huge medical bill? Okay, so let's go over that example. So the premiums, right, will stay the same, except this time Rick anticipates $19,100 in covered in-network medical expenses with that $300 subjected to that 75/25 deductible. Okay, so let's do 10% out of 19, which is 1,900. There's no deductible. Maximum out of pocket wasn't really reached there, right? So it's just the co-insurance plus the premiums for that year, $7,840. Let's do the same thing for the 80/20 plan, 20% or 3,800. There's no deductible, but look at this time. He actually hit this plan's maximum out of pocket. Okay, it's 2,500. So that co-insurance is supposed to be 3,800, but because that maximum out of pocket is 2,500, that's all he's going to have to pay for that calendar year. Okay, so we can change that co-insurance to 2,500, add back in the premiums for that year, equals out to $6,030. Okay, last up, let's do the 75/25 plan. So this time that deductible comes into play. So we'll take that right off the top and then do the 25%, 4,700, add back in the deductible, actually hits this plan's maximum out of pocket right on the head at 5,000. Okay, so it's 5,000 plus the premiums for that year, $6,003. So the plan that saves the most money in this scenario also is the 75/25 plan. Interesting, huh? So this might be a good year if you folks are ever thinking of switching over to that 75/25 plan, because it looks like the numbers are in your favor this year. But again, we have to wait for negotiations to finalize. We're just using the splits for this current past year. Um, but yeah, it looks like this is a pretty safe plan this year. Of course, don't switch because the guy from EUTF told you to. Okay, it's totally up to you guys if you want to switch or not. But according to these numbers, it looks like it might benefit you folks. Okay, last up, we have a Kaiser Permanente example. So they have two plans, a comprehensive and the standard plan. Comprehensive for a whole year for premiums is 3,620. For the standard plan is about $1,030. So Malia will undergo surgery and was told the cost before insurance pays could be $50,000. Okay, so under the comprehensive plan, there's actually no charge. Okay, that's why it's called the comprehensive plan. It's really good. Things like surgery, you don't even have to pay anything. Okay, so it's just the premiums for that year, 3,620. Under the standard plan, there's a 15% co-insurance or 7,500. But again, this plan has a maximum out of pocket, so it's going to protect her. So we can change that co-insurance to 2,500, add back in the premiums, $3,530. Okay, so the plan that saves the most money in this scenario is also that lowest costing plan, which is the standard plan for Kaiser. Okay, so that's kind of how you want to look at plans. You want to look at the premiums, and then you want to look at what that plan's maximum out of pocket is and kind of guesstimate what kind of services you're going to have for that year. Okay, let's talk about the enrollment form real quickly. Please ensure you have the correct form, then complete all sections of the EC1 form. Okay, so you wanna download the latest form from our website. Okay, if you find a form lying on the ground or you get a form from your friend, do not use that. Okay, go to our website, download the newest form. Attach any applicable proof documents and then submit your form before the deadline. Okay, the deadline is April 30th, and you need to submit that to DOE EBU. Okay, it's on the top right hand corner of the form. Okay, real quickly, I'll go through how to fill out the form. So on the top section, you want to check off open enrollment and then complete all the line items, right? Name, date of birth. You do not have to put your full social if you're already in our system, maybe just the last four. But if you're enrolling for the first time, we will need your full social. Coverage start date is in the middle section of the form. You can leave that blank because anything that you turn in during open enrollment will go into effect July 1st. Okay, plan selection and contribution. Employees must check the box of each plan they wish to enroll into or to be continued enrolled into. They may enroll in only one medical prescription drug plan. Okay, so you cannot pick the 90-10 plan for yourself and then put the rest of your family on the 75-25 plan. Okay, it doesn't work like that. You all have to be enrolled into one plan altogether. Okay. The life insurance is 100% employer paid, so always make sure you check off the life insurance enrollment. Back of the form, your dependent information. So if you're adding, you're continuing, or you're deleting a dependent, make sure you fill out that section completely. Okay, so these are the proof documents. If you're adding a dependent for the first time, we will need a copy of like your marriage certificate or birth certificate. If they're already in our system, we don't need any proof documents again. Okay, other types of insurance, if you have like TRICARE or Medicaid or something like that, list those other insurances there and then just read, sign, and date the form. And again, turn that in to DOE EBU by April 30th. Okay, all proof documents must be received in order to process enrollment changes. Okay, and then once we receive it, you don't have to call our office if we got it or not. You'll get a confirmation notice in the mail. Okay, usually you'll get that in May, maybe early June. If not by then, make sure you call our office. Okay, and then always review this confirmation notice. Make sure there's no errors. If there is an error that you see, we do have a corrective action form that goes along with this. Just fill it out, send it back to us. We'll correct the error. Okay, money saving tips. Okay, we're wrapping up, folks. Choose a plan that's right for you. Okay, so see in-network providers, non-network providers usually cost more, and then use the ER for emergencies only, right? Um, if you get a paper cut, right, you don't want to go to the ER for that. You can wait to go to the doctor the next day. Just stop the bleeding, right? Every time you go to the ER, it actually makes all the premiums more expensive for the next year. Okay, so of course, if it's a medical emergency, please go to the ER, but don't go to the ER for anything non-life threatening. And then picking the right providers and facilities, you want to look at the cost share, your monthly premiums, and the maximum out of pocket, right? Like we talked about. All those things can help save you money if you can do the numbers correctly. And then trying generic over brand name usually has the same active ingredients, but it costs 3 to 4 times less. Okay, so always check with your doctor to see if generic is right for you. We always we know that sometimes, brand name just works better, but if you can, try generic. And then mail order for maintenance medication. It's convenient. You can get a 3 month supply for a 2 month supply cost. So you can save a lot of money. So contact CVS or Kaiser to get started. And then real quickly, we have some wellness programs. So annual physicals and screenings. Okay. So talk with your doctor. You can get these every year for free. So take advantage of that. Tobacco cessation products and programs. If you're thinking about quitting, disease management programs. If you have chronic conditions like asthma, COPD, HMSA and Kaiser have great programs to help manage those. And then health coaching. Okay. So if you're thinking about exercising more, or maybe eating a little bit more healthier, HMSA and Kaiser have great programs to help jumpstart that. Okay, so all these benefits are usually covered at 100%. So take advantage of them, people. They're really meant for you guys to keep you guys healthy. Okay, just some quick reminders. Deadline for the employees to submit the EC1 or EC1H enrollment form is April 30th. If you're adding dependents, all proof documents must also be received by April 30th in order to process enrollment changes. All changes take effect July 1st. And then for employees who do not want to make any changes, again, no action is needed. It'll just roll over. Okay, folks? Okay, so that's all I got for you folks today. I hope you guys learned something new. If not, I hope I didn't bore you guys to death. Other than that, you guys are free to go, but I will try to answer some questions if there is any questions in the comment section. Okay. Other than that, have a great rest of your day, folks.